Hello, I'm Matthew Weinstock with Hospitals and Health Networks with a preview of the July issue of our magazine. This month is the 16th annual Healthcare's Most Wired Survey and Benchmarking Study. I'm joined by my colleague Susanna Hopsalleren to talk about the survey and some of its findings. Susanna, thanks for being with me.
Thank you, Matthew.
So, as I said, this is the 16th annual Most Wired Survey. This year we had a record number of hospitals and health systems submitting surveys, and also a record number of hospitals that are designated Most Wired. Can you give us a little bit of data there?
This year we had 680 surveys submitted, and that represented 1,900 hospitals. That's a third of the hospitals that are registered in the United States. Out of those, 375 met all of the criteria for Most Wired.
And Most Wired covers not just clinical IT, right? We cover about 4 different categories across hospitals and how they're using health information technology systems.
Yeah, we cover infrastructure, business and administrative management, clinical, quality and safety in the hospital and the outpatient setting, and then we also look at clinical integration across the healthcare community and even in the patient's home.
So Susanna, this year for the first time we also designated 20 advanced Most Wired hospitals. Can you tell me a little bit about what those organizations are doing that sets them apart from the rest of the Most Wired?
These 20 organizations are more sophisticated in their use of security systems. They are also able to restore their data in case of a disaster very quickly. They use business tools for processes and also for clinical systems. All of their clinical processes are hardwired. They have electronic, evidence-based order sets. The transitions in care and the care plan are all electronic. They have systems to let them know that quality measures and quality indicators are being met on all of the patients. So they are feeding themselves intelligence as they go along. Their use of quality scorecards and also electronic registries puts them in a position to really deliver not only excellent care within the organization, but also moving towards population health.
And Susanna, one of the hallmarks of the Most Wired survey and Most Wired hospitals is using health IT to advance patient safety initiatives. So for instance, we know from 2005 to now we've seen a 6-fold increase of med matching at the bedside with barcode technology. What other trends in quality and safety have you seen over the years?
Well, I don't want to underestimate the importance of really reducing the errors in medication administration and how using IT as an enabler has really changed the game. And this is a very significant improvement, but it's also an improvement in not only the technology used at the bedside, also the technology used in pharmacy management and the supply chain. So you have 3 major areas where technologies have advanced and our processes had to change in order to accomplish this. And we are now seeing that not only with this type of quality and safety improvement, but also with other areas, we have more sophisticated governance processes in place. So we're able to also see if there are problems with safety related to the deployment of health information technology. And the use of scorecards, feedback to clinicians, and the use of checklists are all making a huge difference in how clinicians are able to absorb the changes that are needed in patient care and to do a better job.
One of the trends I thought was interesting in this year's data too was the increased use of analytics throughout the hospitals. Obviously, as we move to this more of a value-based reimbursement system, analytics and data are going to become more important. Can you give us some highlights of the trends you're seeing in terms of data analytics and population health data?
We're still in the early stages here, Matthew. I mean, there are about a third of the organizations can actually take claims data and clinical data across the community and come up with a patient care record. But it is exciting that we are at that stage right now. And when you're looking at really more of the further analytics, we might be a little bit further ahead in terms of being able to analyze quality improvements across the continuum of care, but this is still an area that needs to be paid attention to, and we need to learn how to use the tools.
I guess lastly, Susanna, you're intimately familiar with all the data that's come in from these 680 survey submissions. What stood out to you this year? Were there any big surprises to you?
Probably the most exciting development was the implementation of the patient portal in a much bigger fashion, use by the patient. And when we kind of dug a little deeper with the folks who submitted surveys, we found out that they're really working hard to educate patients on how to use the patient portal. 58% of the most wired are actually providing a mobile app for the patient portal. So they're taking the initiative to find out how to best communicate with the patient and how they can access that data. The other finding was that we're chipping away at that continuum of care and communicating across the continuum, but we're not always able to do it with the HIE. We are very often having to do some kind of peer-to-peer IT infrastructure, and that's how we are really kind of hobbling together that continuity of care record and that profile of that patient.
Well, great, Susanna. Thanks for being with me today.
Thank you, Matthew.
And so for ongoing coverage of our Most Wired survey, be sure to check out the July issue of the magazine, as well as throughout the rest of the year where we have guest CIOs commenting on various portions and data from the Most Wired survey. I'm Matthew Weinstock. Thanks for tuning in.